Order. Welcome to this afternoon's session of the Foreign Affairs Committee. Professor, could you perhaps introduce yourself just for the record?
Yes, thank you for the invitation to appear today. I'm Professor David Harper. I am a senior fellow at Chatham House, where I work on the Global Health Programme.
Could you just say a little bit about your background as well?
Yes, for a large part of my career I worked at the Department of Health and managed a number of emergencies. I was the Director General for Health Improvement and Protection, and perhaps particularly relevant to today's discussions, I managed the department's response to the H1N1 flu pandemic in 2009-2010. Then I went to the World Health Organization as a special advisor on secondment from the Department of Health. Then I left and set up my own one-man company, and much of my time is now spent with Chatham House.
Excellent. Thank you. Chris, you wanted to start?
I remember you from 2009. Could you just... There's a strong perception, whether this is fair or unfair, that Britain was some way behind other countries when it came to repatriating people from China. A, is that fair? And B, why do you think that might be the case?
So could I preface what I'm going to say by making very clear that I don't have any particular informed insights about the situation in China and some of the other areas I'm sure that you would like to discuss this afternoon. So what I'm going to say is largely based on what I've heard through the media and through my own networks. The repatriation, I think, was incredibly challenging. I think the risks that need to be balanced, I would expect, would include risks to the individuals, risk to the country that people will be leaving, and of course risks to the receiving country as well. And that's a very complex set of risks to get to grips with. My assumption is that in taking the right advice and taking public health advice and advice from experts, the decisions were made at the appropriate time. But I really don't have any more information on whether it was slower than it could have been or should have been, or whether it was very much in line with other countries as well.
Well, it was slower than the United States and Japan, for instance.
It was, and that was reported. I don't know the basis for the decision, so I can't really comment much more on why the timing was as it was.
You said that there will be challenges. I understand, obviously, that, well, maybe you'd like to say a bit more about what those challenges might be, apart from the simple question of whether we wanted people to come back to the UK.
From a public health perspective, I think that balancing the risks that I've mentioned really present a huge challenge, because if the issues are not very well considered and carefully considered, decisions can be taken and actions taken that actually have unintended consequences. It's not to say that decisions shouldn't be taken, and on a precautionary basis they very often are, but I think taking the advice that's necessary to inform those decisions is a vital part of it. And logistically, just moving people from one place to another, one might say particularly from that part of the world, can present particular challenges of themselves.
But if you look at the present situation, most MPs have got some constituents somewhere in the world who are now either in a place that is highly affected, like Italy or Spain, or are in a place which is in some version of lockdown, where the hotel where they may be staying is throwing them out on the street because the hotel's closing. What choice does the British government really have other than to repatriate in circumstances like that?
I think that's a very good question. It's hard to see, with the responsibility and the duty of care for British nationals overseas, what else could be done. But saying it is one thing, achieving it, I know, just from travelling the world myself, is a very difficult situation. It's everything that can be done needs to be done, but it doesn't necessarily mean that will give the outcome that everybody would like. What I would add, very importantly, and what I've heard not just through media reports but also through contacts that I have, Communication is probably the one area that could be improved markedly, and people that are in these difficult situations, at least some, and we have social media now where people are interviewed in situ, as it were, they're saying very often that they're not seeming to get the information that might help them. So they feel quite isolated, and I think that's something that I would expect, without knowing how this might work, that could be addressed as a priority, at least to let people know that they're not alone, to reduce some of the anxiety and to reduce some of the stress. And that's really looking at it from a public health perspective.
Just imagine let's say there are 500 Brits stuck in Madrid, many of whom have either medical conditions of their own or need to get back to the UK to be with elderly family or to support other members of the family or whatever, have no finances to be able to stay on in a hotel without, which may be closing. What is to stop the government hiring an aeroplane, one of the many hundreds of aeroplanes sitting in Heathrow at the moment, and flying to Madrid and picking them up?
Well, this is not my area of expertise, I'm afraid. I can't say why that can't happen. One would think intuitively that would be a way of approaching it. I'm assuming if it's not happening, there are either logistical reasons, there are reasons from the Madrid perspective or from the UK perspective, where it sounds easy to me to say, to agree with you, to get a flight to go and pick people up. The fact that it's not happening makes me think that it isn't quite that straightforward. But I'm only commenting as a member of the public.
Okay.
The handling of the cases on the various of the cruise ships offer a slightly different question, because, of course, many of the people on the cruise ships either have actually gone down with the virus or have been connected, very closely connected with people who may have the virus. It also, of course, the age demographic on cruise ships tends to be older than, for example, the average people who go on holiday. Can you comment at all on the handling of those, given your experience, particularly of H1N1, when the response amongst older people was different?
I'm bound to say again that I can comment from what I've seen, what I've heard. I can comment from a public health perspective, which is that the principle of keeping people quarantined is a tried and tested principle in public health terms. It's been done many, many times before with success, a successful outcome. If we go back to the Yokohama cruise ship, it seemed very clearly from even at the time the situation as it evolved that quarantine wasn't actually, the conditions weren't being observed. It's hard to know quite what went wrong, but transmission occurred where it shouldn't have done, and I know that this will be looked at in great detail, but of course people are rather preoccupied with other things at the moment. Once we see the results of a detailed analysis of what went wrong, that will help us know for the future. And I should say that whilst we're in the midst of this current situation, it's never too early to start learning the lessons. And we said this back in 2009, 2010. We put things in place then, research that was necessary during the outbreaks themselves to be able to inform, ideally, future responses. And I think this is a situation where that might well be the case. We will learn a lot from the cruise ship situation.
Can I ask a question then, based on your personal experiences, 2009-10, in the H1N1 viruses? What did you get right? What did you get wrong at the beginning that you improved during the process, and how do you look at those incidents today?
We were fortunate, if I can use that word, in as much as we had been preparing for an influenza pandemic. Because of the situation with avian influenza, H5N1, a lot of effort because of those concerns and the risks that were perceived at the time, and still discussions, many discussions, not just nationally, far from it, and not just multisectorally nationally, which were very important, whole of government and eventually whole of society approach. We worked internationally. We worked very closely with our G7 partners. We worked very closely with the European Union and with the United Nations, and particularly the World Health Organization. So we had a great opportunity and a lead in time, so that when it actually happened, we were, I think, as well prepared as we could reasonably expect to be. But there were issues. Communications, always a big issue. It's sometimes hard to say until you have the benefit of hindsight how that could have been improved. But we tried very hard from previous experience to identify a trusted spokesperson, to be very visible, to be visible even when there wasn't a great deal to say, when the situation in the early days was not changing. But sometimes it's important for somebody just to say that, not to wait until there are a raft of measures to introduce, which of themselves can cause great confusion.
Sorry, so that's, forgive me, I'm not trying to criticise the early responses to H1N1, I'm just trying to understand what lessons were learned. And your point about communication there in global pandemics, I don't wish to focus on the UK response, but on the global response. There's been a remarkable unwillingness, and perhaps expected unwillingness, by the WHO to call out nations that are doing better or nations that are doing worse. Is this just the nature of the WHO, or is this something that they could do better?
WHO, first I should make clear that WHO is made up of different parts, but is largely, it's a member country-based organisation. So the countries have a very, very powerful voice, and rightly so. The Secretariat that people sometimes see as being the World Health Organization, Dr. Tedros and the people in Geneva or in the regional offices or country offices, they are a secretariat that are there to provide the administrative support, the expertise that goes into running the organisation and providing the guidance and the operations that are necessary. The reason I'm saying it like this is that it's very difficult, I think, for the WHO to be particularly critical of an individual country, because they recognise the sovereignty of countries and states to take their own actions.
May I then ask the question differently? Have I misunderstood the role of the WHO? Perhaps the answer is yes. And the correct thing to do is to recognise that actually in cases like Ebola, where they responded extremely slowly in calling out the various different national failures, is there an argument to say that actually we shouldn't be waiting for the WHO at all, and we should be looking for alternative ways of coordinating if the WHO, as you rightly say, is a member-led organisation and is very unlikely, quite obviously, to criticise those who are paying or those who are shaping the policy within it?
I think personally, the way to improve the situation would be to work with the World Health Organization, maybe in peacetime, to address the sort of issues that you're alluding to, because it is the leading UN agency. It should be in a position to be able to do the sort of thing that you're describing, and I think at times...
And yet it doesn't.
I think at times it would feel constrained, not just financially, but in the sense that we're just discussing, that it is a member country based organisation. It's very hard. It does happen, and the international health regulations provides a framework for the WHO Secretariat to do a large part of what it does. But the world is dependent very much on the World Health Organization for its risk assessments, for bringing information from countries. It is the organ, if you like, as well as the organisation that receives all of the information at a very early stage, and then as a situation like this develops, it is collating, assessing the numbers that it gets and providing information to the countries on which they should be able to base their actions and their decisions. But countries are very able and encouraged to make their own risk assessments and to take actions on the basis of local risk assessments. So this is the way the organic nature, if you like, works.
Can I, Royston?
About lessons learned and about a global response. My inbox is full of lots of people giving me advice on what I should be saying to government or what government should be doing, and they frequently reference 1918, but they almost never reference 2009. And I remember 2009 because I was but a humble leader of a modest-sized council, and we had our pandemic planning and all the other things that went with it. But people seem to have forgotten that, and it almost looks like governments have too, in a way, because there are different approaches to what's happening. There seems to be panic sometimes, and almost as though this is new, this virus is new, of course, but 2003, 2009, that's not new. That wasn't even that long ago, but it's almost like there's a collective amnesia to it. I mean, I might be being unfair, but it feels a bit like that, and it does from my constituents, and it looks a bit like that with governments and perhaps the WHO. So is that an unreasonable thing to say?
I don't believe that WHO have forgotten 2009, the H1N1 pandemic, or SARS, or MERS, or Ebola. They are very, very conscious of these situations, and they do their best to learn the lessons. In fact, they have their committees and many other analyses that are done post-event that informs the WHO's learning. I think it is probably fair to say that governments, if by governments you're talking in the collective sense, aren't preoccupied by the H1N1 pandemic, and in a sense, why should they be? Different governments around the world have their own immediate priorities, and often they're different people that are in government from the people that lived through those episodes. It doesn't mean that there's not a record. The officials, the experts, the public health community, in that sense, part of the government machinery, they will all be working very hard, looking at what happened, looking at what they can do better, and preparing for the situation that we're facing now. But it's for the public health professionals, the scientists, the researchers, and ideally governments providing resource to fund research, etc., to be able to work together. But it's not entirely surprising, I think, that governments, in the sense of ministers and the elected individuals, have their own priorities, and so aren't thinking back to SARS or to MERS until it becomes necessary. But they have people who should be doing that.
Okay. Henry, you want to come in?
Thank you, Chairman. Obviously, we've seen over recent weeks a number of closing down of travelling, different advice being given by different countries as the pandemic has affected them. Earlier in the House of Commons today, we heard the Foreign Secretary now advising against all but essential travel of UK citizens abroad. Clearly, there's a huge economic impact that is resulting because of those advice against travel and outright bans. How much do you think economic factors should be taken into account, and the economic impact of travel bans beyond just the, as it were, pure health advice against travel?
So, again, it's an excellent question, and it's in a way the perennial question. If I go back a little to an earlier stage in my career, I was very much involved with risk assessment and risk management. And to the purists, I'll say, but it's good practice for the assessment to be separate from the management. And governments are there as the top risk managers to take those decisions, taking account of all of the different factors that they need to take account of. For the people that are doing the assessment, the modelers, for example, the public health professionals, up to a point, that should be separate and shouldn't be tainted by those other issues from a health perspective that you just mentioned. The reality, however, is different, and many people are in a position wearing different hats. And so it's not unreasonable to suppose that a senior public health professional would absolutely be giving attention to the social disruption and economic effects and so on and so forth. But ultimately, the advice that's coming from the different quarters should be factored in for what it is. So the public health advice, the modelling, the real health side of it is going in to help inform ministers and the people sitting around the table in COBRA who are the risk managers in this sort of case.
And if I may, just a brief supplementary on that, in terms of consistency of travel advice, how much do you think there should be an attempt for international consistency on that, given that obviously different jurisdictions and regions are affected in different phases?
I think it comes back largely to this the sovereign nature of countries and states and territories. The situation will vary, as you've just said, country to country, society to society, culture to culture, but also in terms of the epidemic spread. So it's good to have a framework in which to make decisions and to have the information on which to base those decisions. I think trying to have a blanket approach doesn't work from a public health perspective, and that, in a sense, is one of the reasons that the guidance that was used in the 2009-2010 influenza pandemic from the World Health Organization was revised to try and unlink the sort of political decisions, the decisions from Geneva about declaring a public health emergency of international concern or declaring a pandemic. All this discussion about the word and the use of the word pandemic served as a distraction in the current situation, in my view. But these were very important points of process and procedure back in 2009-2010. It was recognised it was a constraint, and countries, and even within countries, because of the heterogeneous nature of the spread of a disease such as influenza or COVID-19, it was necessary to unlink it so that people could make their own decisions according to the prevailing conditions at that time.
Yeah, thank you very much.
You spoke there just a little bit about the words, whether it's a public health emergency of international consequence or whether it's a pandemic. Is any consideration given to any factor other than the medical and scientific data, or does the WHO take in any? It's not influenced by any other considerations when it makes that decision.
It has a committee of experts, an emergency committee that provides the advice to the Director General if we're talking about a public health emergency of international concern under the international health regulations. And the experts that come together are essentially health experts. So they will take into account as much as they can the impact of what they're doing and their discussions on travel, trade, and where that impacts on public health. But I wouldn't expect them to take into account the sort of financial pressures that I think may be at the back of the question.
The reason I'm just trying to be clear is they wouldn't, for example, be considering a particular market, a particular geography, a particular industry, for example, insurance or whatever, and the implications of that. They will be taking it on purely factual basis.
They're looking at the very often a new situation, a spread of a disease or something that will cross borders. It could be a chemical, it could be radiation, it could be, in this case, an infectious agent, and that's what they're focused on.
Sure. Graham, you wanted to come in?
You explained to the Chair the structural problems in the World Health Organization in dealing with problems. After the Zika and Ebola outbreaks in 2014-2016, there was a lot of criticism of the World Health Organization, both on grounds of dysfunctionality and in terms of its actual practical delivery on the ground. What improvements have been made since then?
There has been... I left the World Health Organization in 2013, first to say, but even in the time that I was there, we had begun to consider MERS coronavirus, what was then and still is a concern, another influenza type, H7N9, that had emerged in China. What has been happening on a progressive basis is that the whole area of preparedness and the guidance and the discussions that are facilitated by the World Health Organization, the Secretariat, have been taking place to try to help in advance of the next emergency. In addition, the setting up of an emergency program and a reorganization within the Secretariat itself to bring together people from different disciplines in a different way has been done essentially, I think, to address the sort of criticism that you've alluded to.
Can you sort of explain to the committee how the Ross Fund has been used over that period?
Sorry, how the
Ross Fund has been used?
I'm sorry, I can't really comment.
Right. Because you're not aware of it, so you don't know the details?
I don't know the details.
Right. Thanks. Where you've got situations, as appear at the start of this outbreak, where China was treating the disease politically and appeared to be not being completely transparent with the figures, it was locking up clinicians who were trying to alert the Chinese public and the world to what was going on. What do you think the response of the international community should be in that situation if the World Health Organization can't deal with it?
This is a really tough issue for me to comment on because, again, from a public health perspective, the key objective is to have information as quickly as possible and ideally as high quality information as can be achieved. Anything that can be done to improve that situation is absolutely the right thing to do. That's not about the global community in some way reacting to what you described as the Chinese situation. From the WHO perspective, I know that they were encouraging the information from China to get as much as they could conceivably get under the international health regulations to be able to begin to do the risk assessments that we've been talking about a little bit this afternoon. But how the global community might react is outside my field of expertise, I'm sorry.
Let me ask it in a softer way. Given the structural problems of the World Health Organization, then, do you think there is a role for the G7, G20 or any other international body to step into that vacuum?
So I don't know about structural problems as you describe them within WHO. I think what they have now is a structure which has evolved. It's not the right word to use. It has changed quite remarkably over the past few years to be able to perform its functions as member countries have agreed far more effectively and far more efficiently. So I think it has changed the way that it works and is a far more nimble organisation. But it has its challenges, and I think those are the ones that we talked about a little earlier. In the time that I was in the Department of Health, there were meetings that only started when I was there of health ministers from what was then G8. And I recall a number of very good discussions where like-minded ministers were coming together, but working with the World Health Organization. It wasn't a substitute for, it was there to complement what the World Health Organization was doing as the UN agency responsible. It's hard to see a situation. I think there are things that only G7 could do or G20, and that's right and proper. But if we're talking about a public health response or public health preparedness, there is an infrastructure, and if it's not working as member countries think it should, then that's the thing to address, as I said earlier. But it is likely to cost money, and we've seen recently countries or a country taking a decision to reduce funding. This is, from a public health perspective, it's a tough one, yes. Yeah, the US, it's very well documented. Right now, it's brought into sharp focus. Here we have an organisation that has tried to adapt and to move, and I think has gone quite a long way to do that. There are always improvements that can be made without a shadow of a doubt, but in order to do some of what it is required, it needs resourcing, and I think sometimes that's a tension that isn't always recognised.
Is there anything more that the Foreign Office can do to increase the effectiveness short of cash, and cash always helps, to increase the effectiveness of the World Health Organization?
I think the diplomatic circles that are absolutely the bailiwick of the Foreign and Commonwealth Office. There are occasionally things that can be done in country that will help the functioning of the World Health Organization, I think, quite considerably. So there are sometimes national issues that can be addressed, I'm sure, through embassies, through consulates, if people were to become engaged in the right way. So I think that's certainly one thing that could be done to help facilitate conversations that are sometimes necessary and aren't happening in other countries at the local level. That's one way that the Foreign and Commonwealth Office could help things.
Final question, you may not be able to answer it. It might be, as you've said, to the answers to some of the other questions beyond your immediate expertise. Do you think that the US ban on travel from the EU, and now the EU plus the UK, is a measure of the failure of international relations, or is it just the sort of arbitrary nature of some of the decisions coming out of the President's office?
Coming out of, I beg your pardon?
President Trump's office.
I don't know the basis for the decision, of course. I can speculate. It's from a public health perspective, the sorts of travel bans that were implemented at the very early stages of the outbreaks might have some impact on slowing the disease, the spread of the disease, if the travel bans, if I can call them that, were used in the context of other measures as well. It's not enough just to ban travel, but there needs to be case finding, contact tracing, and so on, quarantining, isolation. As a package, there is evidence to show that travel bans can have some impact. But once there is community transmission, the impact of travel, it's very, very low, if at all, in public health terms. So one would speculate that there are either political reasons, most likely, or other reasons that are out with the public health world.
Thank you.
Chris? Forgive me for this question, but you might have spotted that in Russia, a sort of scientist, and Russian television has said that coronavirus was started by the British, that it was developed at Porton Down or at Pirbright, with a deliberate intention of masking Brexit, and that just as we smeared the door in Salisbury with Novichok, so we smeared Wuhan with coronavirus. This is what's the polite way of saying this is all not true?
I think I would probably say far-fetched. The impact of the current situation is so remarkable, and the potential impact even more remarkable. It's unthinkable. For me as a public health professional.
It's unthinkable, but I worry, my anxiety is partly about misinformation as well. Because, because misinformation in this field it can cost lives, can't it?
You're absolutely right. I couldn't agree more. I'm completely with you. The current situation, what the WHO are calling the infodemic, it has become a major issue in terms of impact on public health, and it would cost lives. People need to get to grips with this in terms of how social media can be used and abused. There are lots of tools out there that could be used for good. The risks, though, are huge indeed. Couldn't agree more.
Can I just jump in straight off the back of that? The Chinese government's spokesperson has been blaming the United States. Given that there is not any great discussion as to where this epidemic started, could you just be clear that that's as laughable as the accusation of any other group, and strikes many of us as particularly bizarre, given that it was the silence and fear brought about by Beijing's tyrants that exposed China to this terrible disease, and since then the world?
I can really only repeat what I've said, that myth-busting is going to become probably a discipline in itself. You've used some words there that I wouldn't, as a public health professional, comment upon, but it is very important to get as much information for the people that are the trusted communicators that I mentioned earlier to be able to use.
How likely do you think it is that this disease emerged from anything other than the wet markets of Wuhan city in Hubei province?
Everything points towards that being the source of the outbreaks at the moment. That a lot more needs to be done in scientific and public health terms to elucidate pathways of transmission, source, reservoir, and so on. And that will be done. That's been done successfully in the past with other diseases that we've been talking about today. So that will become clearer and clearer with more and more information. But there's no reason to suppose for a moment that the allegations that are being made have any basis in reality.
And just given your experience in public health emergencies, and you must have known about previous COVID viruses as they have existed, what likelihood is it that any country government system could have manufactured this?
Wow, these are very good questions. Coronaviruses, as we know, there's no need to manufacture a coronavirus. That's the first thing to say. There are coronaviruses in nature that can be changed if need be, that can be adapted quite naturally. It is possible now, with technology that we have, to create or recreate organisms such as viruses. So hypothetically, the science, the technology exists to be able to do that sort of thing. But there is no driver, there is no reason. What we're seeing, from my point of view as a public health professional in the current situation, is clear. It would have to be something quite remarkable that has gone on to create a situation that the sort that you're describing.
So you would say it'd be better if governments focused on dealing with the real emergency rather than creating science fiction in order to justify their own failures?
That's an excellent way of putting it. Those are the words that I would have liked to have come out of my mouth.
I give them to you.
Thank you.
Royston.
Can I just go back to travel bans a bit? So I don't know, I don't want to make criticisms of anyone particularly, but I think that people would suggest that the US was slow in reacting, and some people within the administration thought it was not as important as it is, and then overreacted or reacted with a complete travel ban, followed by the EU, now followed by us. Are they the right things? Are those travel bans the right thing to do? And is there to contain it? And is there a right time to introduce those? Or is everyone now just playing catch-up with the one that's decided to go first?
If I can, again, talk from a public health perspective, which is really the only perspective I can reasonably talk from on this one, there are different types of travel ban, and what I was talking about earlier was, in a sense, it was there intended to slow, if it was done early enough, to slow the spread of the disease. The countries that we're now seeing, the UK today, you mentioned earlier, the Foreign Secretary announcing a travel ban, that to me is done for very different reasons from a public health perspective, and is an extension, if you like, of the measures that were announced yesterday in terms of social distancing, trying to reduce the social contact, trying to reduce unnecessary travel and to protect vulnerable populations. In part, that's the public health part, but then I would also expect there to be considerations that go beyond that, which would be how do you get people back? People know that or should be aware and look to the FCO to advise them on risks. So people would expect to have as much information as they can get from the FCO and from others. So I think all of that is part of the decision from the UK perspective. And I'm sure there are lots of other things that I wouldn't know about as well. Whether there's a right time, there might be a right time for an individual country. That's what we're seeing today, but there isn't a blanket time to do that. So it's not really playing catch-up, I think, in the sense that you maybe meant. People have been saying that the measures the UK have introduced are slow, that they're behind what has happened in other European countries. The experts, the people here in the UK who are informing the policy decisions, some of the best experts in the world, and they are saying, yes, but the epidemic is in a different place here. We are now taking the decision for the UK at the right time, and we didn't need to take it 3 weeks ago or 4 weeks ago or whenever other countries were doing that. And I think that's a reasonable reasonable point of view.
Thank you.
Can I just ask, you touched on the G7 or rather G8 in your time beginning the health ministers' dialogue. Do you think that there are forums, in your experience, do you think there are forums other than the WHO in which groups could be brought together to respond quicker or more assertively? As you said, the WHO acts more as a secretariat. What about the G20?
So I have to be a little bit careful in the way things are interpreted. I said that the WHO is a composite organisation of member countries and the Secretariat. Sure. The Secretariat is doing what member countries have asked it to do. So that is it's a way that the organisation has developed and wasn't intended as a criticism in this context.
Forgive me, I'm not intending it as one. I'm just saying, given that we're looking for a response mechanism, not just a coordination mechanism.
So there is the response mechanism exists through the World Health Organization. We have seen it most recently in DRC. We've even more recently, in a sense, with the WHO staff who went to Wuhan to see what the situation was, to verify, validate, collect information. That is all absolutely, to me, right and proper for the World Health Organization to do. The problem I would see, there is an infrastructure, there's a framework in which response can be facilitated, information, etc., etc. It depends what countries are looking for. That's the key question. If the WHO is not doing what countries are looking for, then sort out the WHO first and foremost. But there are other things that there's a group that I was involved with which exists still, which was called the Global Health Security Initiative, which were like-minded health ministers from G7 plus Mexico that came together quite a number of years ago and worked very, very well. And it provided the officials, so people at Director General level who were the official group that shadowed the ministerial group and met frequently, they created a trusted network. And I have to say, from a personal perspective, in 2009, 2010, the value of being able to pick the phone up and talk to my opposite number in Paris or Berlin or Washington to say, how much Tamiflu are you buying? Or to have that sort of confidential discussion, which very unusually is an off-the-record discussion, but that made my life so much easier and helped the response. Now, that's something that grew because there was a need. It wasn't there in any way to replace the World Health Organization. It had a specific function. But in a policy sense, in terms of informing the risk management decisions that we've been talking about, I found that very valuable indeed. So there are other mechanisms that can be created if there is a need to supplement, complement that big international global response machine that is WHO.
So would you say that at this stage it's worth really reaching out to many of these organisations and seeing what they can offer in terms of coordination, or is there a risk of, as it were, over-coordinating, having too many different bodies?
Yes, because I wasn't talking about coordination. I was talking about a particular need that was addressed by a particular group, and I think that's a very sensible way to look at this. If there is a need for, let me say, it's not harmonisation, it is a need for exchange of information, for research, for that is a function of the World Health Organization. Coordination is an interesting concept because you have sovereign countries that are doing their own thing. So I think member countries, it would be a great discussion to have at the World Health Assembly to say, look, this didn't work in the way that we wanted it to work as member countries of WHO. What is it that we really want? What do we think was lacking? And can WHO deliver it? And if not, then there is a basis for thinking about a possible alternative. But at the moment, it's hard to see an alternative outside the WHO framework other than the sort of situation that I've just described to you.
So if you were to be empowered by the Foreign Secretary to attend the next World Health Assembly, what would you be asking for?
I would be asking, particularly after the analysis that will be carried out, that will the International Health Regulation Review Committee that will say this worked really well, that didn't work really well. I would look at that and I would say, well, some of these things were said back in 2009, 2010. The committee that looked at that H1N1 pandemic, they said, you need to do this. It hasn't happened. Why not? Same thing with Ebola. 2014, as you say, there was a review committee and they said, why haven't these things already been implemented? Well, there will be reasons for that. And if I was at the World Health Assembly, I would be asking the question, why haven't these things been done? And if it comes down to finances, if it comes down to other things, then at least there's an opportunity then to improve the situation.
Graham.
Two final questions. This kind of infectious outbreak of a disease has been top of the Cabinet Office register for some time. Given a perfect scenario, which we haven't got, of international collaboration, and tomorrow, maybe today, a vaccine is made which will deal with it, we haven't got any capacity to manufacture it in this country. Do you think that is a serious failing, both of the international response, because there's a lack of worldwide capacity, and of our national capacity?
There are ways of addressing national capacity where national capacity isn't available, and it's not just the UK. If we look at the international scene that you've just touched on, many countries around the world don't have vaccine manufacturing capability, and this is something that the World Health Organization recognised with influenza, and they set up a framework where the industry contributed financially to be able to improve the capacity, to be able to improve the access to vaccine, particularly from those countries that would find it most difficult. So there are different ways of managing the sort of situation that you've just described. With the vulnerable countries, the countries that are less able to respond than maybe some of the countries we've been focused on this afternoon, I think it's very, very important to have the benefit sharing that people talk about. So, for example, with viruses emerging in some parts of the world where those people need, the global community needs access to the viruses to make vaccines, but the country from which the virus originated can't afford the vaccine. That was the thinking behind setting up this mechanism and this framework quite a number of years ago on influenza. Well, it would make complete sense to me to have a much broader framework to cover other viruses. Why would it only apply to influenza?
But the point I'm making about the United Kingdom is we don't really have manufacturing capacity, and I suppose what the answer I was looking for was that we should, if we really are to reduce the risks to the people in this country.
And my response, I'm sorry for not being very clear, is that it's not necessary to have national vaccine manufacturing capacity if there are ways of achieving the same end through agreements.
Surely that depends on the actual quantum, the size of it. Because do I think it's real-world politics that China or Italy are going to sell us vaccines while their own population are dying?
There are issues, and undeniably those sorts of issues. I can only really go back again to 2009, 2010. At that point, a lot of effort went into, there wasn't a flu vaccine for the H1N1 strain that emerged, but a lot of work had been done internationally, including within the European Union, to facilitate the process, the licensing and all of that sort of thing. But what the UK did was had contracts in place, commercial contracts with vaccine manufacturers, advanced purchase agreements in place, so that we were near the head of the queue whenever it was that we needed vaccine. And those were triggered when the pandemic was declared. Now, you can look back and say, well, actually, we ended up with a lot of vaccine that we didn't need because of the way the pandemic proceeded. But you can't plan. Your insurance policy is along the lines, from my point of view as a public health professional, that I've just described. So there are ways of addressing the issue that it'd be fantastic, wouldn't it, if countries had more vaccine manufacturing capacity. But that comes down to the economics, the commercial situation, and so on and so forth.
Final question, if I may. If I can go back to one of your previous answers where you said that basically we were 3 weeks behind other countries in terms of their response to it because they had more intense impact of the disease at the present time. There's one area which we do seem to differ internationally, not just in timeline, but in our understanding of the science, and that is in the closure of schools. Do you think we've got that right?
I would go with the advice from the best experts that we have, who are saying, as people know, because it's been reported widely, that at the moment it doesn't seem to be the right time to go for school closures, but it is absolutely on the table. The only comment I would like to add to that is that one reason that I would absolutely go with the experts that I've just referred to is because I've been in that world, and I can say with some assurance, I'm hoping that the situation hasn't changed markedly, but we did our very best to get the best expertise. What could be done, though, which is discussed currently, is making the basis for the decisions absolutely open and available to other people to have a look at it, because if they can't, they will criticise it, and then you get conflicting information. But I'm not questioning the decision, and it might well be in the next period there will be school closures with all of the ramifications that school closures will bring.
Thank you.
Chris, you wanted to come in?
Yeah, on the school closure first, I'm not advocating not listening to the medical advice, but there is a confusion when we share a land border with the Republic of Ireland, and Northern Ireland doesn't have any school closures, and the Republic does, and that is causing some anxiousness, particularly in Northern Ireland. And there is conflicting advice from within what the EU are doing, almost as a collective of states, and it's been reported this week that the Health Secretary is either not being invited or not taking part in discussions with the EU health ministers. So my first part is there is a confliction with one of our literal landholders, and also we don't appear to be engaging with near neighbours. It's not about Brexit. I'm not having a dig about Brexit. I'm talking purely about, you've said through quite a lot of the answers, that we should be sharing information and engaging on a sort of international basis.
Yes.
But it does seem as if we are not doing that on the basis that maybe we should be.
I think you have described the situation. I can only say again that it should be that information is available on, as I was just saying, on which there can be some scrutiny by a wider field of experts than the ones that are directly involved in the assessments and the informing policy decisions. It really is not possible for me to comment on whether it's the right or the wrong decision, say, for Ireland to close schools or for other countries to close schools. They might well have different considerations, different social structures. From the UK perspective that I know some more about, there are the what I would call the fairly obvious knock-on effects of school closures when we are, from a public health perspective, trying to protect those vulnerable people. And it is not uncommon, as we know, in the UK for children to spend time, if they're out of school, with grandparents for child-minding duties or to look after their grandchildren. That would fly in the face of trying to protect the most vulnerable population. That stacks up from a public health point of view to me, in my opinion, but there might well be very good reasons, I'm sure there are, for other countries to take the view that they need to close schools.
Is there not also an element that I certainly know of one school which cares for kids with various disabilities, where all that's happened is the parents have had to take on the responsibility that the school once had, except now it's doing it in a less safe environment. And I don't just mean in terms of sharing potential pathogens, but also in terms of the home which is being used is simply not geared up for that kind of care. And so actually all you've done is shift risk and increase it rather than diminish it.
I think these are very good points. I expect many of them will have been taken into account in the unintended consequences, because we have sort of been here before with influenza, of course, different situation, with children being affected in a way that doesn't seem to be the case with COVID-19. But these, I should have said earlier, it's entirely reasonable for a school of its own volition to close, taking advice from public health professionals. But a blanket closure of schools at the moment, informed by the science, doesn't seem to be the appropriate thing to do. But who knows what will happen next week?
Alicia, you wanted to...
My apologies for bringing statutory evidence. I was in a DL committee passing statutory instruments, so apologies. I have two very different questions. My first one is about how we balance behavioural science and the field of actual medicine and science. And obviously we have to be driven by the science, but we recognise that unless you look at behavioural science and behaviours and psychology, it doesn't matter how good the medical advice is, we won't follow it. Do you think we're getting that balance right yet in the UK? How would you improve it? And is there anything particularly innovative that you think we should be doing that the behavioural science will tell us that we're not?
I can't say for sure what the current situation is, but I can say what we did back in the influenza pandemic. And we made very clear that we needed high-level, high-quality social science input from social psychologists, behavioural specialists, involved very much in the assessment process. So one of the committees that I chaired for the Department of Health, as it was, included somebody I just saw on TV this morning from the University of London, who is a social psychologist. Obviously, you have limited opportunity to get people sitting around a table. You can't necessarily take everybody, but you take people who are opinion leaders and expert and have their own networks to be able to then take off discussions if they need to elsewhere and come back to the main committee. So we try very hard to do that sort of thing, and in many ways the policy decisions at the time, even the communication, or particularly the communication, when to roll out pre-prepared phases of communication, were informed by the sort of, not just the communications experts, but the social scientists in a much broader way.
And if I may, my second question is about, it's a very specific one, so bear with me. It's about mass gatherings and how we tackle those. So a big concern for me, I represent Rutland and Melton, is our cattle market, which is absolutely vital to our economy. The cattle markets across the country are vital. They make most of their money in the month of April. The rest of the year they pretty much run at a loss. So for all cattle markets across the country, April is really pivotal. So we are looking at, and working very hard with departments, about how we ensure in some way that farmers can still bring their livestock to market or sell them in some way. If we find us in a place where we have to hold some form of market, is there anything in particular in terms of mass gatherings that you would advise, that you learnt from previous experience, or is it literally just a case of there is nothing you can do, mass gatherings are a bad idea? Is there any advice essentially for the cattle markets if we are able to keep them open?
Yeah, to the committee, but
oh, sorry, of course. I'm so sorry. I had a moment where I just went into coronavirus mode. I'm so sorry. I'm happy to draw the question if that's helpful.
Forgive me.
I'm so sorry.
I
was in full coronavirus mode.
If you have a desperate desire to answer it, Professor, you're very welcome to.
I'm so sorry.
No.
Yeah.
We can maybe talk.
I apologise. I'm
that
so
would
sorry.
Be maybe a bit more appropriate. Forgive me.
It's like Bob asking about separating out of light earlier. So yeah.
Forgive me. We're extremely grateful for your time, particularly today. And can I just summarise one of the most important points that you made right at the beginning, which was information. Even if you have nothing to say, the confidence of a reliable, trusted source of information was your prime lesson from H1N1. Is that correct?
That was a very important point, and I think it applies absolutely to the current situation.
Is there any other sort of key generic learning that you would take?
That I would like to see happen now? I think it is probably along the lines of it's never too early to learn the lessons and to try to implement as you go. It's a moving field, and it's, in this case, rapidly moving. I think that's what should be happening. I hope it's what is happening. But it's important to set up the framework to learn those lessons during the outbreak. It's not always something that can be done retrospectively because the chance might have gone. Very important to set up.
And you would do that with partners around the world? Not just in the UK? I
would, as far as I could, but bearing in mind people are very focused on dealing with the immediate issue. It's not something, prioritisation has to apply, but I would be looking internally, nationally, but absolutely working with my international partners.
So perhaps one of the instructions you might give were you to be Foreign Secretary would be to ask the embassies as they're reopening, not immediately now, but as they are reopening, to engage with whichever nation they're in as quickly as possible to draw the lessons. So at least they're ahead of the curve for next time.
For sure, and also